Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar K. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, from today onwards we will start a series of lectures regarding Ayurveda guidelines for the management of infectious disorders. What are the different core principles which is explained in Ayurveda as far as infection control is considered? Actually, we are giving more focus on the management of the Graha Rogas, which is explained in Kamabhritya. Because what I strongly feel is the treatment principles and management principles which is explained for the Graha Roga, treatment of Graha Rogas, can be very well applicable as a general guideline for the infectious control or control of infectious disorders. Of course, we will see the details in coming classes. So today we will have an introductory class regarding the same, that is Ayurveda guidelines for the management of infectious disorders. In this we are giving more stress to the management of Graha Rogas. Okay, now to start with the basics, disease prevention. So what do you mean by disease prevention? The procedures or the activity which is designed to protect the patient and other members of the public from the actual or potential health threats and its harmful consequences is called as disease prevention. So procedures or the activity which is designed to protect the patient and as well as the other members or other members who are residing in the public or in the family with the actual or potential health threats by the particular infection and also its complications, harmful consequences. Not exactly the disease control. Disease control is reducing the transmission of the disease agent at a low level that it ceases to be a public health problem. That means when I say the disease control, infectious disease control, suppose it is reducing the transmission of the disease among the public, among the family members or among the group of people, and a disease agent, the disease causing agent, its transmission has to be broken down somewhere else. The chain has to be broken down at a low level that it ceases to be a public health problem, so that it should not cause any public health problem in futures. Therefore we want to control it in the beginning itself by seizing its break. That means we are breaking the chain of a transmission. Now, disease prevention, this explains many important principles. It explains the different operations which aim to reduce the disease, like decrease the incidence of the disease. When I say disease prevention, these are the different points which comes under this. So when I say disease prevention, it is decrease the incidence of the disease. Okay, we are reducing incidence of that particular disease in that given particular area. Or we are decreasing the duration of the disease. Previously it is coming for 10 days, now it is only controlled within 1 or 2 days. That is also disease prevention. Previously the incidence was very high, now the incidence is low. That is also disease prevention. And another important point is reduce the risk of disease transmission. Of course, disease is still there, but the transmission rate is now decreased. That is also disease prevention. Reduce the effects of the disease like physical, psychological and psychosocial complications. Although disease is there and it is happening, but it is not causing much complications physically, psychologically, socially or psychosocially. And also reduce the financial burden on the society. This is also comes under disease prevention. So disease prevention is a broad term which includes all these important points. Now specifically coming to the infectious disease. Any illness which is caused by an infectious agent or its toxic products which can be transmitted directly or indirectly or through the vectors from the reservoir to the susceptible host is called as infectious disease. This is the exact definition of infectious disease. A infectious disease is an illness which is caused by the infectious agent. It may be a virus, it may be bacteria, it may be parasite, or it may be anything, infectious agent, or sometimes the toxic products which is produced by this infectious agent. Okay, and this is transmitted either directly by touch or close contact, etc., or indirectly by fomites, etc., or even through the vectors like fly, housefly, mosquitoes, etc., from the reservoir, from the source of infection to the host, susceptible host, the patient who is suffering. So this is called as infectious disease. Now, what are the prerequisites for the transmission of the infectious disorders? For the transmission of the infectious disorder from one person to another person, in other words, say from the reservoir to the host, what are the prerequisites which is required? Because knowing these prerequisites is very important, because if you are trying to do the infectious control, we have to break one of this particular chain, because this is a chain events and we have to break the chain somewhere in between, then only the infectious control will be there. Otherwise we cannot able to attain the control over this. So knowing this fact is very important. So what are the prerequisites for the transmission of the infectious disorders? Number one, the presence of the microbiological agent. Presence of the microbiological agent. So agents may be like virus, agents may be like bacteria, fungus, etc. Another one is presence of a reservoir of infection. Okay, there is some reservoir is there. That reservoir may be a man, or reservoir may be an animal, or an infected case, any infected case, or a carrier may be there, or birds may be there, or inanimate like soil, etc. Sometimes so many infections are present in the soil itself. So this is reserve. From the reservoir, now this infection is spreading elsewhere. So one is the presence of microbiological agents, another one is presence of the reservoir of the infection, and third one is portal of exit through which the microbiological agent leaves the reservoir. Okay, that is also important. It is present in the reservoir, from which route it is exiting the body of the reservoir and going to the another body. Okay, so it may be through the skin, or it may be through the mucous membrane, or it may be through the secretions of the respiratory tract, maybe through the GIT, stool, urine, or genitourinary tracts and its secretions. So this is how this infection which is present inside the reservoir's body is now going out, and now it may infect another person. Okay, now comes the mode of transmission. So once it goes out, what are the mode of transmission? Mode of transmission is maybe by means of close contact, or maybe by means of direct or indirect contacts like fomites, etc., droplet infections, or through some of the common vehicles like water, milk, etc., or maybe through some of the vectors like flies, housefly, mosquitoes, etc. Sometimes it may be airborne, sometimes it may be foodborne, or sometimes through the dust, mites, etc. So these are the mode of transmission. Now, what is importance of knowing this is we have to break one of them in between. Otherwise, either you have to block the microbiological agent, either you have to break the chain of reservoir, either you have to interfere at the time of exit, or mode of transmission like that. So another is, once the mode of transmission is there, then again it enters into another individual's body. So there will be a portal of entry. Previously we have got portal of exit, now portal of entry. So portal of entry through which the microbiological agents enter inside the host, from the reservoir to the host. Again, it may enter inside the host through the skin, or through the mucous membrane, maybe through the respiratory tracts, maybe through the GIT, stool, or so many other genitourinary tracts, close contacts, etc. These are all the different portal of entries. Now, presence of the susceptible host. Now, usually infections are not so easy to occur, and if the host is immunologically fit, it is not so easy to any infection to enter inside anybody's. That means a normal host. But once a host is not good, in the sense host is immunologically not fit, is immunodeficient or immunocompromised, or there are some weak points are there in the body of the host, then it is quite easy access to the infectious agent into the body of the host. Okay, so these are the different issues where we have to interfere. Okay, either you increase the immunity of the person, or either you block the portal of entry, either you block the portal of exit, either you block the mode of transmission, either you block the reservoir itself, either you block the microbiological agents itself. Okay, so these are the different points where actually we have to interfere. Now next comes how to control. To control the infectious disease, we have to break the cycle at the weakest point. Now, of course, we can block at any point. We can break, but it is always wise to see which is the weakest point, and it is easy to break it. Okay, so to control the infectious disease, we have to break the cycle at the weakest point. So we have to identify the weak point, like whether the agent is very weak, whether the mode of transmission is very weak, whether the portal of entry or reservoir is very weak. We can interfere there itself, so that it cannot come in contact with the each other. So this is also a intelligent decision. Okay, so if you are trying to break the chain at the strong point, so it is quite difficult to control, rather than if you try to break the chain at the weakest point, easy control will be achieved. Now, well, you can control the infectious agents itself. Okay, virus, bacteria, parasites, etc. So how you can control the infectious agents itself? Yes, you can go for sterilization method, you can go for disinfection method, you can go for personal hygiene advice, then you can go for environmental control, and you can use the mask, you can use the PPE, personal protective kits, etc. So this is control of the infectious agent. Another is control of the reservoir. You can also control the reservoir. So that means how you take charge over the reservoir, by doing the early diagnosis. Okay, by early notification, you come to know that yes, this particular disease is spreading through the animals, this disease is spreading through the birds, or this is spreading through the bats. Okay, this is spreading to the pigs. So you identify the reservoir. So once you identify the reservoir, then it is very easy to control the disease. So you can go for isolation and quarantine methods, so that this particular reservoir will not come in contact with the other persons. This is the second way. Third one is control of the transmission. Okay, from the reservoir, that particular infectious agent, how it is transmitted to another body. Okay, so now how you will control it? So you have to go for vector control. Okay, so yes, you can have a control over the mosquito spread or mosquito breeding or some other facts. Okay, so you can change the environment, vector control, personal hygiene. So this is how you have to block the transmission. Change in the environment means sometimes the infectious agent may be transmitted easily in the cold environment, sometimes in the hot environment, sometimes in the humid environment. So you get in control of the environment, number one, or disinfection of the environment itself, so that this particular organism may not grow like that. Vector control is very important, mosquito, houseflies, etc. and personal hygiene. The last one is control of the susceptible host. Okay, so you can also interfere at the level of the susceptible host. So host can be given with the active immunization. So you're not able to control the infectious agent. Suppose you're not able to control the infectious agent. Suppose you're not able to control the reservoir. Suppose you're not able to control the transmission. Okay, now the best way that you have left is you control the susceptible host. So you make him strengthen by giving active immunizations or passive immunizations or combined immunizations, chemoprophylaxis or non-specific measures, some of the drugs, screening, surveillance. So these are the different methods how you can control the susceptible host. So this is some of the important things which comes under the disease control. In the next class we will continue the same. Thank you.